My name's John Conway, and I am a nurse here in the Valley. I work with new graduates and new hires to the ICU and work on training them to their jobs in the ICU and caring for patients. In addition to that, I also teach for Maricopa College District downtown at Phoenix College and work with generally first and second block students in getting them acquainted with going into the hospitals and working with patients as a clinical instructor, kind of holding their hands and making sure that they know patients aren't going to get hurt or die just because the students touch them. My first or second semester teaching is when I got involved with some very remedial simulation experiences on campus. And I had an occasion where I had some very advanced students that were already beyond the skill level of the design of the simulation. And I worked a little bit further with them in recognizing some different aspects of what a patient might have with cardiac murmurs. And based on that, I then developed a charting tool that then I was able to program specific data into the mannequins themselves to bring the students to let them look at and use their own critical thinking skills to develop what their assessment would be. And then afterwards, I had them compare notes with each other to see who was more accurate, who got the idea of what was being presented to them. I never really expected to be invited to present anything with this. It came as quite a surprise. It's all part of my master's presentation for Northern Arizona University. And literally my instructor dragged me kicking and screaming down this road to use a combination of simulation to develop charting skills. So the overall title was Simulation Instills Skills, the skills being where healthcare is being directed with the electronic health record process. So what would happen is a student would be brought into the simulation lab, and all the information that we would want them to be able to use critical thinking skills to assess the patient would be used, and they would then be brought to a discussion with their classmates and then possibly on to electronics charting, where they would then input all the information that they developed from their assessments. With the experience that I'm having as a clinical instructor and again as a teacher in the hospital at the bedside, the availabilities in the hospitals are drying up for students to be able to go into and get any kind of experience whatsoever. So my thought is seeing, or my hope is to see simulation fill the gap in that so that the students still get some sort of experience. And it would be a situation where real time could be compressed to a simulation time to where when they give a medication, they'll see an immediate response, not having to wait 3 or 4 hours to identify whether they've made an error or they've made the right decision, and then be placed in a situation to further develop those critical thinking skills to treat their errors or to identify another problem that will be presented to them.